Hi guys, if you're new to following me, my name is Lily Amelia. I have stage 4 endometriosis and I have just started this page and the idea of weekly group chat therapy sessions, sort of like a peer therapy session, because I just feel like there are so many of us out there and we're talking on a lot of Facebook chat groups, but I just thought this might be a bit of a better way. So please keep along with my Instagram. What better way to introduce myself to you than day 2 after an emergency laparoscopy, because they found a massive adhesion. It was about this long and attaching my part of my bowel to my pelvic wall. So, I mean, I can put up a photo in between and show you now as to what they found, but I'll just give you a prior content warning that it is graphic content. But it was very validating because it didn't show up on any scans at all. We've been trying to hunt down what the problem was for the last few months. I had like a $10,000 private surgery booked, and I ended up having it done through Medicare, through the public system, because it just became so urgent and I couldn't wait on a waiting list anymore. I just had no quality of life. So bear with me today. I'm just going to introduce myself, walk you through a little bit of what Endo Full Circle is, my background, my story. I am on painkillers at the moment, so hopefully I don't seem too off with the pixies. But yeah, we'll see. I'm just gonna put some makeup on today because I just want to feel a bit better about myself. And what better way to do that than to just bring some normalcy? I'm like a big advocate for bringing all of your skincare and everything into, if you're planning a hospital stay, bring everything you can with you, like your face masks, your skincare, bit of makeup. I also use a lot of aromatherapy. I have my diffuser. If you have a hospital roommate, always ask if they're comfortable with that, because some people are very sensitive to smell and it makes them feel a bit sick. So I always ask permission first. But yeah, I've got a whole list on the page of tips and tricks of things you can do while you're in hospital to make your stay a bit more comfortable. So check that out. It's called the Ultimate Hospital Bag List. So I've already got my base on. I just wanted to tell you my story. So I began having symptoms pretty much from the time I got my period at 11. I knew that the pain I was having was probably not normal. I was already missing school by the age of 14 every month. And I think at first my parents just thought, gee, maybe she's just like really socially anxious, because I have always had a bit of general anxiety. I mean, most girls do. It's pretty normal. But it turned out to be something a lot more than that. So I have a very like pivotal memory of at the age of 16 when all of my friends went to do work experience, which is common in Australia. At the age of 16 you do like 2 weeks off school and you go and pick like an internship. Instead I did surgery and I went and had my first laparoscopy. They found nothing, and that is very common. I just want to reassure some people that during your first laparoscopy for endometriosis, they might find nothing because it can be microscopic and it does take a really long time for it to grow to a point. This is why it takes like 10 years for women to be diagnosed. It takes a really long time for it to grow to a point where the surgeon can actually see where it is. And we've come so far in terms of knowing like endometriosis grows its own nerve endings. That's why it's so painful, and if you even have those excised and chopped off, like the end of the nerve can freak out a little bit. My second surgery was at the age of 22, I want to say, and that was by a really great surgeon on the Gold Coast. Unfortunately, he's no longer practicing, he's retired, so I won't drop his name, there's no point. And he diagnosed me with stage 2, and I think his wise words to me were, why don't you just have a baby? Like, you know, everyone who has a baby, like the endometriosis just goes away like that. And I was like, that seems a little drastic to me. Like, have a child when I'm not ready for it, or cope with a disease. I don't know. Both are like kind of crazy options. But anyway, so I obviously chose to try and cope with the disease the best I could. I didn't foresee that getting pregnant with my current partner at the time was a great idea. Turned out I was right. And anyway, so carried on. I've had so many cysts in and out of hospital since then. I've had miscarriages. I've had one ectopic pregnancy miscarriage, which was quite frightening. And what was really frightening about that experience is that I am so used to my endometriosis being so awful and just like terrible symptoms that I didn't even know I was having a miscarriage. I thought it was just my normal endo pain. So I almost like had a life-threatening thing go on, and I only caught it at the last minute. And that was when I was really given a bit of a shock and woken up that I had to take better care of myself. Then the third operation was when I was about 27. I'm 31 now for context. And I was then diagnosed with stage 4, and that was by one of the top surgeons in Sydney, Australia, who I still absolutely think his work is fantastic. His name is Dr. Surya Krishnan, and I highly recommend him. He's fantastic, although he's generally a private surgeon, so if you don't have private hospital cover, it's going to be a bit pricey. Don't recommend. Definitely, if you have been diagnosed with endometriosis, go and get your private hospital cover, because you're going to need it. Even if you have to wait 12 months to claim on it because it's a pre-existing condition, it's still worth it. And so that was massive, that surgery. When I was about 26, 27, he did a 3D ultrasound, which is a new technology. And that was his way to plan the whole surgery before going in, because the disease was so widespread by then. It was all over the back of my bladder, my bowel. There was one ovary that was stuck, and he told me, I can't guarantee that you're going to wake up with 2 ovaries. He said, I also can't guarantee that I can do this all in one surgery. So that was really frightening. I still remember that experience really well, and just like shaking before going in, you know, when they go in before you go in for surgery, and I was just like this. I mean, I'm always like that before I go into surgery. Anyway, I woke up with 2 ovaries. He did a fantastic job. He did it all in one surgery. He was very proud of himself. I was very proud of him. And yeah, and then unfortunately since then I've had a number of ovarian cysts. Not so much the endometriosis has come back, but I've had some really bad cysts. So that was surgery number 3 with Dr. Surya Krishnan in Sydney. And DM me if you'd like his details. I'm happy to share. Charlotte Tilbury Beauty Light Wand is amazing, except for when you put on too much, like I just did. And then I unfortunately had a tiny patch of endo grow back in 2023, and it was excruciating. It just happened to be on my left ovary, and it was in a spot where I had to go to the ER and beg them to open me up and have a look, because again, it didn't show up on scans. They were like, we think you've just had so many surgeries that you're oversensitive to pain, which is the thing, it can happen. So I ended up begging them to, and I said, please, I can tell you exactly where it is. It's a 20-cent coin piece of disease, you know, of endometriosis on my left ovary. I can point to you where it is. If you open me up, I swear you're going to find it. Just remove it and I can go on with my life. It's not going to be a huge endo surgery. Sure enough, after begging and crying and pleading, and like, don't get me wrong, the Royal Women's Hospital, or Royal Hospital for Women in Sydney is amazing. Sorry, I'm speaking fast because I'm trying to fit a lot of information in. They are amazing, but it is a public system, and it's gone on like an emergency case basis, and that was not necessarily considered an emergency case until I had to explain to them that like I was in so much pain, I was having dark thoughts basically. And that's the truth of endometriosis, is that it can get that bad. And you have to communicate that and advocate for yourself that if you are in the ER and they're not doing enough to investigate, you need to let them know, I actually can't live with this pain. And that can be a very, very true, accurate thing. That endometriosis pain is a very real thing, and it can really impact your mental health severely. So don't discount what you're going through, and be really kind to yourself. And that's why I started this group. So that was surgery number 4. I was right. They opened me up. They found about a 20-cent coin piece size of disease on my left ovary, removed it. I was great. I went on and I lived my life. Unfortunately, I kept getting hemorrhagic cysts after that, which is probably due to some kind of hormonal imbalance, I'm guessing. So, which brings us to surgery 5, which I've just had. In the last 4 weeks, I developed severe spinal pain and a severe feeling of, again on the left side, like there was a band from here to here. And if I would wake up in the morning with full bladder, ready to, when you've slept all night and you bust into pee in the morning, and when my bladder would deflate, I would feel everything rip, like it was literally trying to leave my body. And it was excruciating, and it actually got to the point where I was so scared to drink water because I didn't want to have to pee. And for some reason the pain was referring right all the way back into my spine, and that was really, really getting to me quite severely. So yeah, I ended up coming in and out of the ED 3 times before I was finally transferred to a bigger hospital. And then I had to beg them yet again and say, please, please, please open me up and have a look. I can tell you it's going to be there. It's going to be a cord, like a ligament, a adhesion that we call it. And I'm telling you, it's going to be there, and that is what's causing the pain. And I was right. There's something so satisfying with endometriosis, girls, about when you are right about telling someone where your pain is, and then them opening you up in surgery and they get rid of it, and I'm feeling excellent. I mean, I'm very sore after surgery. Obviously the gas that they use to pump up your stomach is the worst part, and these are all the things that I like to talk about in the calls in a lot less scattered of a way. I just thought I had some time up my sleeve today. I would post this. And yeah, so that's my story. That's like, I've had 5 surgeries now. I'm the queen of turning a hospital room into a spa session. Please refer to my Ultimate Hospital Bag guide list. The aim of Endo Full Circle is so that we can come together in weekly group calls, like a Zoom call, and we can all have a chat, share our stories, share our hot tips and tricks, and go about things that way. I just think that it can be a really isolating experience having endometriosis. It's so isolating, especially when you're having to beg and plead for someone to listen to you, when things aren't showing up on scans, and you're just totally dying inside slowly. Haha, very funny. But I started Endo Full Circle so that we can all meet and chat and share our stories, and I can give advice on types of scans, and other girls can give advice on types of birth control that they've used. We're not medical professionals, we're not trained counselors. That's not what this is about. It simply is a peer support community. And so I really look forward to anyone sending me an email. Give me your time zone, because there's like a worldwide community of people who've showed interest in this, not just the Instagram page, but on all the Facebook support groups. There's been a lot of interest. So when I put it out there the first few times, I got like a massive influx into my email inbox, which means there's a lot of us out there who are needing a service like this where we can come together and chat. I'm not charging for this service. This is all free. It's just a volunteer thing. I'm looking at getting guest speakers on as well, because I'd like to have some different views, like holistic therapy views, and then also some surgeons who are at the forefront of research into this chronic illness. There are so many ways that we can grow with this, but it grows by us all committing and showing up to these group chats. Never underestimate the power that we all have of coming together to speak about things and be heard. There is still more finances put into men's erectile dysfunction research than there is endometriosis. And the stats of how many women are being affected by endometriosis now are getting terrifying. It's something like, I'm not going to drop the stat because I'm on too many painkillers. I can't remember the stat and I'm going to get it wrong and someone's going to correct me. But I just know that it's getting really scary out there. And we need to jump up and down and scream, because it is not normal for a 31-year-old girl like me, or you, or your sister, or your friend to be living day to day, or several times out of the month, having to take opioid painkillers, having to have 5 surgeries, having to have 1 surgery, having to have scans that don't pick up on a disease that could potentially spread into all of your organs. It behaves like a benign cancer. There are a lot of doctors coming out and saying, why is this not classified as a type of cancer? Because it behaves like one without the relief of death. And I know that's a very dark thing to say, but really, sometimes this disease gets very dark, and that's why it is so important that we all come together and have these talks and support each other and know that we're not alone. I've lost relationships to this disease. Not all men can handle it. It is a lot. It is a lot when all of a sudden I'm normal and then suddenly I'm shaking in shock and in pain because I've had a cyst rupture or something like that happen. Or I've had partners who think that I just love taking painkillers. That broke my heart. Like, that's something I won't get over for a really long time. I don't find that medication fun. I find it really debilitating, and I don't want to be the weird one out of my friend group that is always on medications. Just any medication at all, even like having to take ibuprofen and Nurofen and things like that all the time, having to carry Panadol with me all the time. Like, I don't want to be in pain every day. So the more we jump together and the more that we keep talking, the more we can gain attention for this disease and try and get some research funding, just more awareness. Like, guys, it's up to us to try and get more attention. So that's a little bit about me. I'm day 2 out of surgery, on a lot of medications. So who knows if it's even a good idea for me to share in this way, but maybe being vulnerable is the best thing I can do right now. It's showing you what it looks like in my very cute hospital gown. I'm not always this bubbly, happy. You know, if you'd caught me a week ago, I was in a really dark place, but I'm just really happy because they found it and I was right. So I'm very satisfied about that. Anyway, I will leave it there for now. I don't know if I'm gonna like chop bits out of this, because I've rambled on a lot more than I intended to. And yeah, it was so lovely getting to meet you guys, and I can't wait to be on calls with you all soon. Just give me like another week to get myself organized, and then we will go from there. So thanks everyone for listening, and